In this module, we're going to walk through how to use this medication in a way that minimizes side effects and helps you get the best possible results. That includes how to inject it properly, how to think about dosing, and some of the most common mistakes that actually lead to unnecessary side effects. A lot of issues people run into with these peptides, medications, substances are not because the medication is wrong for them, but because of how it is being used. So we need to think more big picture, which is typically it comes down to less is more. Before we get into the technical parts, I want to emphasize that one of the most important concepts with this medication is that more is not better. Higher doses does not equal or mean better results. And faster increases often lead to more side effects. I have seen that firsthand as a clinician, that patients who really want to push dosing want to increase dosing quickly because they want to maximize their weight loss and lose weight as quickly as possible. It leads to complications for them in their journey, and we have to dial it down overall. And faster increases often just lead to more side effects, not more fat loss, actually. The goal is to find the lowest effective dose that helps regulate your appetite and supports your progress. So that's where people tend to feel the best. Tirzepatide is a once weekly injection with a couple caveats that sometimes we microdose or fractional dose, especially when we're weaning someone off of this medication or just doing it really low frequency for maintenance. It can be every 10 days, every 20 days, once a month. It varies case by case for the patient. So for those who are in active weight loss protocols, we tell them to take it on the same day each week, around the same general time of day, and avoid skipping. Definitely don't double or increase your dose without guidance. So if you do miss a dose, make sure you follow your provider's instructions for what to do if you do miss a dose. Don't just go ahead and proceed without any guidance there. You can inject the medication into the abdomen, the thigh, or the back of the upper arm. The most important thing is to rotate your injection sites each week, but that doesn't mean like you have to rotate it between your abdomen, thigh, arm. That can even just be rotating sites on the abdomen or rotating between the arms. We just don't want to always be going in the same spot. And I do have a separate video that I will link below or at the end or somewhere that shows you exactly how to prepare, what you need, how to draw it up, how to cleanse the vial, what you should be watching for, how to fill up your syringe, all of those things. But rotating your sites can help with reduce irritation in a single site, which is very, very rare, honestly. It can improve absorption. It can keep the process more comfortable over time. So when you're injecting, use a clean area. Go into the subcutaneous tissue, not the muscle. So make sure you're using the supplies that your prescriber has sent in for you. Typically, that's going to be an insulin syringe. And take your time. There's no need to rush. And see that video I made specifically demonstrating that. After your injection, you're not going to feel anything immediately, and that's very normal. These are long-acting medications. This medication works slowly and builds in your system over time. Some people notice appetite changes within 1 to 2 days. Others, and I would say that's most common, notice changes later in the week, like between days 3 and 5 is when they usually get the most appetite control, decreased cravings, although this is additive. So some people feel the strongest effects a few days to a week or so after injection. And these medications, these peptides, stay in your system for a long time, not even just 1 week. So there's a range of normal, and your pattern might be different from someone else's, and your body will build gradually week after week. That's why, especially at the Core Health Clinic, we start very, very low and slow and allow your body to adapt and acclimate over time. Because, like I said, usually starting at a robust dose or increasing doses quickly doesn't actually contribute to weight loss more effectively. It just increases side effects. So why would we do that? Start low, go slow. You only take it once weekly, and side effects may feel stronger after a few doses. Increasing too quickly can overwhelm your system, and it's not designed. This is not designed for rapid changes. It is designed for steady support. This needs to be sustained over time. So when it comes to dosing, the most important approach is slow and intentional adjustment. You don't need to rush to higher doses to see results. In fact, most of my patients do very, very well at low doses. We prioritize and coach and give guidance for nutrition. Protein intake has to be optimized. We are aiming for bare minimum 100 grams of protein a day in any individual, but depending on your ideal body weight mass, it may be higher than that. Your bare minimum may be 120 or 150 grams, and we give specific guidance at the Core Health Clinic for that. Habits need to be consistent. Moving up too quickly in dosing often leads to more nausea, diarrhea, fatigue, and overall discomfort. Also, those people with more metabolic resistance and insulin resistance building, subclinically even, will typically experience more side effects. Although I will say there's a caveat to that most people, if you are like a very fit form person and you're using this for fractional and microdosing over time, you generally need to start at and stay at lower doses compared to the general population. One important concept I think it's imperative to understand is that your dose can be adjusted based on how your body is responding. So for example, if you have significant side effects after an injection, it may be appropriate to slightly reduce your next dose with the guidance of your prescriber, and then gradually return and titrate back up once your body acclimates and stabilizes there. This is not a failing medication if you are experiencing side effects or if you need to titrate down. That means you're working with your body instead of pushing through symptoms. So a few common mistakes that lead to unnecessary side effects include increasing the dose way too quickly or starting out at way too high of a dose, eating large or high-fat meals, ignoring early fullness. You need to stop eating. And this applies to general life. Sometimes my patients on weight loss medications, they actually have to eat past when they're feeling full to make sure they're getting in the hydration and the protein that they need. But you definitely, if you're at your caloric intake, you want to stop eating earlier rather than later, and eating more frequently in smaller amounts does help well on these medications, I have found. Not staying hydrated does really affect the outcomes. You must hydrate with water. 0 calorie, 0 sugar, no sweetener. Hydration is a must. And we also don't need to be powering through symptoms instead of just adjusting your dose accordingly. And you need to stay in communication with your provider. If your provider does not communicate with you about these things, you need to switch providers. If you're in Idaho or Utah, come see us telemedicine at the Core Health Clinic. These medications respond best to a consistent, steady approach. When your dosing is appropriate, patients feel reduced food noise. This is how to know if you're on the right dose. How do I know if I'm on the right dose or if I need to go up or down? The right dose for fat loss is feeling satisfied with smaller portions of food, having reduced food noise and cravings, having minimal or manageable side effects, maybe it's just a day or two, and then having steady, sustainable products. But remember, I've talked about in other videos, weight loss is not linear. It is more like the stock market, and there are plateaus, there's highs, there's lows, there's weeks where you lose more, months where you lose less. It varies. So just looking at the trajectory over time, we want you to be getting the results that you want for your overall health and well-being and longevity. You should not be feeling miserable. You should not be feeling like you can't eat at all. You should not feel like you're constantly fighting side effects. The goal with this medication is not to push your body. It's to support it. When you use consistent injection habits, and standardized patient dosing and listen to your body's feedback, that is when you'll get better results with fewer side effects. So quieting the food noise, having controllable appetite, but making sure you're able to get the nutrients and the hydration that you need with a steady, sustainable weight loss over time. That doesn't mean that it's going to be consistently losing in a linear or sloping trajectory. In the next module, we'll talk about how to eat in a way that supports this medication so you can better so that you can feel better and get the most out of it. See you in a minute. See you next time.